Good day, everyone. This is Sir Seb, and I will be quickly tackling PT203's first topic, the skin, peripheral vascular system, and edema. So, the skin is the largest organ of the body. This forms a physical barrier between internal and external environments and weighs approximately around 8 pounds, which should be around 3.6 to 5 kilograms. It is approximately 2 square meters or 22 square feet, and the thickness varies from zero point 0.5 millimeters on the eyelids to 4 millimeters at the heels. So, this skin produces antibacterial substances that prevent infection and manufactures vitamin D for converting calcium into healthy bones. And this skin also acts as a waterproof, insulating shield, guarding the body against extremes of temperature, damaging sunlight, and harmful chemicals. So let's talk about some of the functions of your skin. One is that it serves to protect against abrasion, UV light, and microorganisms. Two, the skin functions to insulate. So the hypodermis insulates the body to protect from the cold and produces sweat to regulate your body temperature, protecting the body from heat. Three, the skin aids in homeostasis, preventing water loss from the body and serving as a barrier to the entry of certain microorganisms. Four, thermoregulation. This is pertaining to the amount of blood and the activity of sweat glands action beneath the skin. So, five, the skin functions to excrete waste products through skin and glands. Six is vitamin D synthesis. Now, when exposed of UV light, the skin produces certain molecules that can be transformed into vitamin D, so that reabsorption of calcium in the body can also take place. And lastly, the skin produces oil to help keep itself soft and smooth. So we move on to the structures and layers of your skin, starting with the epidermis. Now, the epidermis is the outermost layer with an average thickness of zero point zero 0.06 to zero point 0.6 millimeters and is composed of stratified squamous epithelial cells. Now, also in the epidermis, you will find a positive finding of your keratinocytes and melanocytes. Now, we'll talk about the layers of your epidermis, starting from the most superficial to the deepest. Now, the most superficial would be your stratum corneum. This consists of many dead cells that are periodically slough, and subsequent hardening and reduction of fluid in this layer increases the resistance to the electrical currents. So deeper to your stratum corneum is your stratum lucidum. Now this is 3 to 5 layers thick, and cells here lack nuclei, while cell borders are poorly defined. Now this is the only layer of the skin again, or layer of the epidermis, that may be absent in the skin, because usually you will find this in the soles of the foot or in the palms, followed up by your stratum granulosum. Stratum granulosum is 2 to 5 cell layers thick, and cells here have a more elongated and flattened appearance. This stratum granulosum is more or less for water and heat regulation, and you may find that there is a reduced intracellular communication due to fewer cytoplasmic processes occurring in this layer. The fourth deepest epidermal layer would be your stratum spinosum. Now, this strata protects the basale, and cells in this layer are bound together by cytoplasmic processes and appear as spines. That's why it's called stratum spinosum, stratum spine. And lastly, you have your stratum basale, also known as your stratum germinativum. This is the deepest layer of the epidermis, where you will usually find cell division occurring. Now, the nuclei tend to be oval and located in the cytoplasm at the stratum basale. Then, moving on, after the epidermis is your dermis. Now, the dermis is also known as the corium. This is derived from the mesoderm and is composed of two layers of irregular connective tissue. This is usually approximately 2 to 4 millimeters thick and is around 20 to 30 times thicker than the epidermis itself. Now, the dermis contains lymphatics, free nerve endings, blood vessels, sebaceous, and sweat glands. Now, the dermis will also contain elastin and collagen. Here we have your dermal layers from superficial to deep. There are only two, if you recall. It's the papillary layer and your reticular layer. So the papillary layer is composed of collagen and elastic fibers and is responsible for the formation of your fingerprints and footprints. Now the reticular layer is a meshwork of denser connective tissue composed of collagen fibers and some elastic and reticular fibers. You may also find your reed peg regions here in the reticular layer. These are this between the epidermis and the dermis. So a little rewind again, there are certain structures in your dermis. So that would be your free nerve endings or your mga blood vessels. But here is a table of the mga receptors and their stimulus. So your free nerve endings would respond to pain. Your Merkel's discs respond to light touch. Meissner's corpuscles would respond to discriminative touch or kanang mga two-point discrimination. Your roof init, that responds to heat. Your cross-end bulb is responding to cold. And your Pacinian corpuscles respond to pressure and vibration. Now we move on to your subcutaneous layer. This layer is also known as the hypodermis as it is beneath the dermis, hypo below dermis, of course. And here you would find your fats and loose connective tissue. Now, what does the subcu layer function as? The subcu layer functions for support, insulation, cushioning, and energy storage. Now, here are some of the accessory structures of the skin listed below. So that would be your hair, sweat glands, sebaceous or oil glands, and your erector pili muscles. So now that we've talked about all the layers of your skin, now we go on to your common skin disorders, starting with dermatitis, also commonly known as eczema. Now, eczema is the inflammation of skin with itching, redness, and skin lesions. There are usually three causes. One would be the allergic or the contact dermatitis, which is due to harsh soap, chemicals, poison ivy, adhesive tape, and maybe the rubbing of your orthosis onto the skin. Mga hugawon na. Two would be the acentic. So this is due to photosensitivity, exposure to sunlight, and UVR. And three is your atopic or your unknown. This is usually associated with family history, allergies, and psychological stress. Then you have your bacterial infection. So under a bacterial infection, I have one impetigo. So impetigo is the superficial skin infection with inflammation caused by Staphylococcus and Streptococci. So impetigo, you would see pus-filled vesicles and itching. For cellulitis, this is the suppurative inflammation of cellular and connective tissue caused by Staphylococcus and Streptococci. Now, in cellulitis, the patient would usually have fever, and a limb, usually LE, would be hot red and edematous. And then you have your abscess. Abscess is a cavity containing pus and is surrounded by inflamed tissue caused by Staphylococci. Now we move on to your viral infections. You have herpes simplex 1, which is a vesicular eruptions on the face and mouth. Herpes simplex 2, which is the vesicular eruptions on genitalia. Herpes zoster, which is basically the reactivation of your varicella zoster virus on the cerebral ganglia of your posterior nerve roots. And this is usually associated now with fever, chills, malaise, and mga GI disturbances. And lastly, you have your warts. Now, warts are usually due to human papilloma virus or otherwise known abbreviated as HPV. So next you have your fungal infections. Now, what is one common form? It is your ringworms. Ringworms form a ring shaped patch on your skin with vesicles and scales. Now, dili ni siya literal worm jud. Again, it's just a fungal infection. Next would be your parasitic infections. These are usually coming from your scabies, mites, and lice. And now you have your skin traumas. Traumas would consist of your kanang mga contusion, ecchymosis, petechiae, abrasions, and lacerations. Now, your contusion, also known as bruising, is the injury with the skin intact. Ecchymosis is the extravasations of blood into the subcute tissue due to fragile or weak blood vessels. Followed by your petechiae. These are tiny red or purple hemorrhage spots on your skin. Abrasion is the scraping away of skin due to a mechanical injury or kanang nadagma. Then would be your laceration, which is the irregular tear of skin resulting to a torn wound. Now we move on to your skin assessment. So pruritus, you would usually see itching. For urticaria, you would usually see smooth red elevated patches on the skin or kanang signs of hives. And then for edema, edema is due to anemia, venous or lymphatic obstruction, cardiac, circulatory, or renal decomposition. So there would be two kinds of edema. One is pitting edema, so this leaves a persistent indentation. And then you have your non pitting or brawny edema. So this is just a hard textured edema. And the assessment for edema specifically would be your limb girth or your volumetric measurements. So we also check for changes in skin color in skin assessment. Cherry red skin would mean carbon monoxide poisoning. Pallor or paleness would mean anemia, fear, arterial insufficiency, or blood loss. Cyanosis is the blue discoloration due to smoking, arterial disease obstruction, congenital heart disease, and lung disease. The color brown would mean venous insufficiency, meaning you would see your hemosiderin stains. The color yellow or jaundice would mean there is a liver or gallbladder problem, and your mga liver spots, which is brown and yellow, are due to aging, pregnancy, uterine or malignancy issues. Then you have your hyperhidrosis. Now, hyperhidrosis, you would see excessive moisture in the skin, and finally, under skin assessment, you would also look for rashes and other lesions. Now we move on to your phases of wound healing. We start with the stages of hemostasis. Now, hemostasis is the body's emergency response to injury with the aim to prevent hemorrhage. This lasts a few seconds, or in the case of moderate to severe pathologies that involve multiple well vascularized tissues, up to several minutes. Now, the initial hemostatic mechanisms that occur within seconds after the blood vessel trauma include vasoconstriction and the development of a temporary hemostatic plug in the damaged vessels. So, coagulation or blood clotting is the secondary hemostatic mechanism. Now, the second phase of wound healing would be your inflammatory phase. This relates to the process of inflammation, of which the aim is to clean the wound of its cellular debris, preparing it for the deposition of new, repaired, and regenerated tissues. These are when localized tissues respond initiated by pathology or injury, and where cardinal signs and symptoms of inflammation would include rubor, calor, edema, tumor, dolor, function lisa, and muscle spasm. So the third phase of wound healing is your proliferative phase. This involves the proliferation and formation of new and immature repair tissues to replace damaged tissue. Now, fibroplasia would pertain to the formation of new fibrous tissue, and angiogenesis pertains to the formation of new blood vessels. Now, the proliferative phase may last weeks or months depending on the severity of pathology and type of soft tissue affected. Finally, Your final stage of healing is your remodeling or your maturation phase. This is the final phase of healing where remodeling or the fiber alignment and maturation or the increase in mechanical strength of immature tissue to form the most structurally functional tissue is possible at the site of the wound. Now, the remodeling phase usually lasts months to years depending on the severity again of the pathology and type of soft tissue affected. Next, so now we talk about the peripheral vascular system, its structures and functions, starting with the arteries. Now, the arteries are also known as your resistance vessels. These transport oxygenated blood from areas of high pressure to low pressure. Now, in arterial circulation, this is maintained by the heart pump. The arteries are influenced by elasticity and extensibility of vessel walls and by peripheral resistance and amount of blood in the body. It also has three layers, which is your tunica externa or adventitia, tunica media, and tunica intima. Now, pressure in the arterial system is normally 90 to 100 mmHg in large vessels, and this decreases by 25 to 35 mmHg when reaching the arterioles. Now, why are arteries known as your resistance vessels? So, arteries are known for vasodilating and vasoconstricting, narrowing and widening. And what does this do? And what is controlled, or what does it control? What is it controlled by? Arteries, that vasodilating, or basically the vasomotor tone of your arteries, is controlled by the small amount of muscles arranged in a helical pattern found in the tunica media. So, again, vasomotor tone is your tunica media, tunica middle, tunica muscle. For your veins, now the veins are known as your capacitance vessels. These transport dark, unoxygenated blood from tissues back to the heart. Now they are capacitance vessels because they are larger in capacity. They have thinner walls and arteries and are greater in number. Veins have one way valves to prevent backflow and include both superficial and deep. They are also influenced by muscle contraction, gravity, and respiration. So, your capillaries are small blood vessels that connect the ends of arteries or your arterioles with venules, forming an anastomosing network. The capillaries function for exchange of nutrients and fluids between blood and tissues. So the capillary walls are thin and permeable. Now we have your lymphatics. Now your lymphatics includes your mga lymphatic vessels, superficial to deep. So this would be your lymph fluid, lymph tissues, and lymph organs. And under lymph organs would be your lymph nodes, tonsils, spleen, thymus, and thoracic duct. Now, lymphatics drains lymph from bodily tissues and returns it to venous circulation. Lymph travels from lymphatic capillaries to lymphatic vessels to ducts to ultimately the left subclavian vein. Now, lymphatics contributes to the immune system function, wherein lymph nodes collect cellular debris and bacteria, remove excess fluid, blood waste, and protein molecules, as well as produce antibodies. So now we talk about hemodynamics and the formation of your edema. So before that, let's clarify some terms. Bulk flow is important for regulation of relative volume of blood and interstitial fluid, while filtration is the pressure-driven movement of fluid and solutes from blood capillaries into interstitial fluid. Now there are two pressures that promote filtration. There is your BHP or blood hydrostatic pressure, which is generated by the pumping action of your heart. You also have your interstitial fluid osmotic pressure. Now, blood colloid osmotic pressure is the main pressure promoting reabsorption of your fluids. So let's also review your Starling's law of capillaries. So the law states that the balance between blood hydrostatic pressure plus interstitial fluid osmotic pressure and blood colloidal osmotic pressure is called the net filtration pressure, or NFP. So if there is a loss of NFP balance, then that would indicate edema. So here I listed down the normal capillary pressures. Your IFOP is 0 mmHg. Your BHP is usually 16 to 35. IFHP would be zero point 0.1 to 5 mmHg. And your BCOP is around 26 mmHg. Now we talk about your edema or oedema. This is the result if filtration greatly exceeds reabsorption, leading to an abnormal increase in interstitial fluid. Edema or oedema is not usually detectable in tissues until interstitial fluid volume has risen to 30% above normal. And this can be caused by excess filtration due to either increased capillary blood pressure or increased permeability of your capillaries. Now, oedema can also be caused by inadequate reabsorption due to the decreased concentration of your plasma proteins. Here in this slide, we talk about the factors affecting blood flow. Now, one of it would be your blood pressure, because blood again flows from regions of higher pressure to lower pressure. So, what exactly are we measuring here? We check or we measure the mean arterial pressure, which is the diastolic BP plus one third of the difference between systolic and diastolic BP. Another factor would be your vascular resistance. So this would comprise of many things. Would be like one, the size of the lumen. A smaller lumen would be greater resistance to blood flow. Another would be viscosity or the blood stickiness. A higher viscosity would mean a greater resistance to blood flow. And lastly would be your total blood vessel length. So again, a longer blood vessel again will result in greater resistance to blood flow. Lastly, you would also have your factors of venous return and velocity of blood flow. For your autoregulation of blood flow, autoregulation would pertain to the ability of a tissue to automatically adjust its blood flow to match its metabolic demands. General types of stimuli that cause autoregulatory changes in blood flow would be one, your physical changes, so due to the influence of external or warming and cooling factors, and would be your two, vasodilating and vasoconstricting chemicals. Chemicals, okay? Chemicals. So now we have some determinants of your arterial flow. One would be the cardiac stroke volume, which is the amount of blood that the heart can pump per beat. Two would be your peripheral resistance, again, tunica media, tunica middle, tunica muscle, vasomotor tone. Then another determinant would be your presence of peripheral vascular disease, and another determinant would be capillary membrane oxygen and other nutrients to be distributed to other tissues. So for your determinants of venous flow, you have your blood pressure gradient, you have your integrity of the veins, you have muscle pumps, and you have the volume of flow. So under volume of flow, any conditions that retard the venous return to the heart will create a condition called venous pooling, leading to stasis ulcers or other stasis dermatological conditions. Now, for lymphatic vessels, they share the same functions as veins. Now we come to the third part of our lecture, edema itself. So edema is the excessive buildup of fluid in the body's tissues. So primarily it's in the extracellular space. Then, edema is typically observed in both extremities, UE and LE, but may also occur in other parts of the body. Now, edema occurs because of excessive accumulation of extravascular and extracellular fluid in tissue spaces due to disruption of fluid regulation as a result of water protein imbalance across capillary membranes. And edema can present in numerous forms, including unilateral, bilateral, localized, and generalized edema. Edema So some causes of your edema would be edema just happens when small blood or lymphatic vessels leak into nearby tissues, causing abnormal accumulation of fluid in the interstitial space. Edema can also present as an acute event in a localized area of the body. Like example, if you sprain your ankle, mahubag siya, there you go, acute event, then and there. Or maybe another sports injury, no? Then edema can maybe more sustained effect and less localized swelling of a limb. So example, mga consequences of cancer treatment. So given that medications, infections, pregnancy, and other medical conditions may also cause edema, and interventions may vary depending on the cause. So now that we are finally talking, Jude, about edema, let's go clarify some terms. Edema is the amount determined by the degree of imbalances in fluid exchange. So edema occurs in response to inflammation, fluid imbalance, vascular impairments, and as a result of systemic issues and comorbidities. Now, edema is completely different from effusion. Effusion is an excess of fluid in a cavity. Example, joint effusion. And is also completely different from lymphedema because lymphedema is the accumulation of interstitial fluid caused by an obstruction in lymph canals that prevents reabsorption of proteins from the interstitium. So, what are the other causes of edema? Edema is caused by low albumin, so protein that regulates blood osmotic pressure. It is caused by allergic reactions, caused by critical burns, caused by heart disease like congestive heart failure. It is caused by kidney disease, caused by pregnancy, caused by severe liver disease like cirrhosis, caused by obstruction of flow. So that's mga peripheral vascular diseases and lymphatic system disorders. And cerebral edema is also one cause. So, for those of you who don't think edema is serious, let me remind you about the adverse effects also. Adverse effects of edema include increased pressure on sensory nerves, leading to pain. There is also increased pressure that blocks blood flow to tissues, leading to tissue necrosis. So, tissue necrosis, cell death, because of its ischemic, it becomes gangrenic, and that will lead to eventual amputation. Then there is decreased range of motion, decreased or disturbance of the joint function, predisposition to infection, and lastly, predisposition to thrombosis or pulmonary embolism. So here are some points of exam and evaluation for edema. So if there is an increase in the size of a limb or part of a limb, we go check the limb girth or your volumetric measurements. If there are sensory disturbances, such as your paresthesia, anesthesia, or sense of heaviness of the limb, we go do a sensory exam. If there is stiffness and LOM, we of course check your ROM and with its end feel. And if there is delayed wound healing, we do an integumentary or a skin assessment. So, in managing edema with physical agents and therapeutic exercises, we can do a few things. One is elevation, which is the placement of a limb in anti gravity position to facilitate drainage. Two would be compression. This is the application of a non elastic, low stretch bandage or an intermittent sequential pneumatic compression pump to facilitate the shrinking of edema. We could also do manual drainage through the use of massage. We can also do cold application, which is the application of ice packs to slow local blood flow and reduce fluid accumulation. And lastly, we can do pumping exercises or ankle pumps. This influences muscle contraction to increase venous return. So that concludes my lecture on the skin, PVS, and edema. It's a very short lecture, so good luck on your short quiz and long quiz.